Guys, welcome back to Medical Coding with Blue. Today's episode is all about what to watch out for in medical coding interviews. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So the beginning time in any medical coder's career is very critical, right? Because your experience is really going to kind of shape your attitude towards the field. And in some cases, it can actually run people off if they have a terrible experience in the very beginning because of the amount of pressure or stress that they feel. And I don't want anybody to have a clouded version of what this career field is. So these are some of the things that you should watch out for. There's 3 things that you really should be on the watch out for, all right? But I will also say this before I get into the 3 things. Do not be so desperate at these interviews that you will do anything, okay? Do not be so desperate to do that because of the simple fact that you, as a certified medical coder, if you're certified with the American Health Information Management Association or the American Academy of Professional Coders, this says that you have competence in medical coding, and competence is really key. So this is a thing that you have to know about yourself. You have a skill that took months to get. Obviously, you demonstrated competency by passing this exam. So you should not allow anybody to take advantage of you. And you should not ever put yourself in a position where you want to work for free or volunteer because you think it may help you. I can't tell you the number of stories that I have, countless stories, from people who have been in situations where they volunteered under the promise that they would get a chance to apply for a medical coding position with that organization, only to be led around and carrot dangled the whole way. That's not right. But it is this new generation of coders coming in. It is your responsibility to say no to working for free, because you should never work for free. And that is my strongest recommendation, because it takes time to build your skill, and it takes time to find a job in this career field, but it is not impossible. Everything cannot be right now. This is not an instantaneous, have it your way type of career field. You have to earn the things that you get, and you do that by starting off, of course, applying for coding positions, or you can apply for alternative positions that will get you experience with coding. Okay, so I will talk about that later. But in the meantime, here we go. All right, so the very first thing that you should be watching out for when you are applying for a medical coding position is the productivity standards. Now, accuracy standards is between 95 and 97% accuracy, okay? But that is something completely different. You are supposed to be as accurate as possible, all right? But when it comes to this productivity, this is where the organization has some sort of play with it, right? On how much they can demand from their people. When you are applying for a position and they tell you, and you ask them in the interview, what is the productivity standard? What is the average productivity that is going to be expected of me? If they tell you it is 200 plus per day, you thank them for their time and you leave. There is no negotiating this, because if they see a person in medical coding as somebody who can produce 200 per day, 200 plus per day, because I've heard of ridiculous stories of 320 average per day, ridiculous. If they see you as somebody who can do 200 plus 300 plus per day, that's not the place for you, because they don't know what medical coders do, because that is not medical coding. That is data entry. 200 plus per day is data entry. All right. And you deserve better than that, because number one, these doctors and providers are not expected to understand the fundamentals of coding. They are not supposed to be coders. That's why they have us. The electronic health record is a tool that may help with the code selections. It may do like computer assisted coding. It may do that, but it does not necessarily mean that those codes that are being selected are correct. And if this organization really thinks that, oh yes, that all we need the coders to do is just kind of push it through and then just give the updates just here and there, and that's all they do. So we can demand 200 plus out of them. That's not an organization you even need to be associated with, because at the end of the day, it is your name on those codes that are being selected. You are responsible for those codes, because at the end of the day, if there's a case that goes to court and you have to answer as to why did you select these codes, and you say, well, that's what my supervisor said, that is not good enough. And if you don't know that, then you need to take a look at the AHIMA Standards of Ethical Coding, all right? You need to check those out, whether you are with AHIMA or not, because we all have to follow those as medical coders, all right? Now, it is important to be ethical, and before you start panicking and think, oh my gosh, can I do this? You can, but the thing is, I'm telling you, you need time to code. So reasonable productivity standards are between like 80 and maybe 150. That's a little on the high side, but sometimes you may find a clinic or a specialty where they're doing a lot of the same types of procedures, a lot of the same types of diagnoses are being seen. So something like that is reasonable, all right? But you really need to ask and make sure, because again, between 80 and 150, that's giving you time to look at it. Now, again, a little on the higher side is because it's sort of the same thing over and over. And there's really not a whole lot of thought that goes into some of those, because the documentation is quite standard. And of course, you're still reviewing it for other things, but there's going to be some times where you have something like that and you may get lucky and you could produce that high amount. Now, average per day, what does this mean? This means that if you are working, right, let's just say you have a quota of 100 average per day, right? And they say, okay, on Monday you work and you did 100, okay? You say, okay, great. But then the next day you ran into some that took a little bit longer, so you were only able to produce 90, okay? And you say, oh my gosh, I didn't get to do all of my productivity for this day, but yeah, am I gonna get in trouble? No, because average per day. Now we're looking at, let's just say the rest of the week. So Monday you did 100, Tuesday you did 90, Wednesday you did 100, okay? And then Thursday you did 105, and then Friday you did 105. Well, guess what? When you average it out over those 5 days and you add that up, that's 100 average that you did per day, because you were able to make up those 10 that you didn't do on that Tuesday. Now, if you are fooling around and goofing off and things like that, and you're not consistently hitting your productivity, then you have a problem. But typically, they will give you what's called a ramp-up period. Some people use different language. I say this, and people all over the U.S. even look at me like, I don't know what that means. Ramp up means that you start low, and then, of course, you go up. Ramp up, right? They're not going to expect you to walk in off the street with no experience and code 100 in a day. They're not. So you're going to take time to learn that electronic health record appropriately. You're going to take time to learn the process appropriately. Sometimes it's 90 days. Sometimes it's 6 months. It really all depends on that employer. But the more that you spend time with it, the more that you practice, the better you'll get at it, the faster you will go, okay? So again, you want to look for productivity between 80 and 150. Okay, if it's lower than 80, it really all depends on what you're doing. Sometimes with inpatient coding, you'll see it really low. But keep in mind, with inpatient coding, and I mean ICD-10 PCS inpatient coding, if you're doing something like that, you're working with entire charts. And these charts can be a patient who stays there for 5 days or a patient who stayed there for 80 days. So it really all depends. So sometimes the average per day is going to be a little lower, but you have to see all what it entails. But for the outpatient setting, between 80 and 150 is reasonable. Anything higher than 150 average per day, you don't want that job. No matter how bad you think you want a job, do not go for that job. Because here's the problem. People who accept this 200 plus per day because they are so desperate to get a job, they just want to go there, collect a check, and go home. there's other things that you could be doing in the meantime while you're looking for a job in coding, because I did it and a lot of other people do too. So don't think that just because you have studied medical billing and coding that you can't work something else until you get into a coding position, because yes, you can. All right. So that's just something that you have to keep in mind. But watch out for those productivity standards. All right. So don't go for those, because that's going to be the employers that they're always going to try to demand more and more and more when it takes time to review these records, and you need to review them appropriately. There is going to be a time where you're going to feel like, oh my gosh, I'm rushing, but that will come with time, and obviously, hopefully, you will have a lot more skill by then. All right. So that's the first one to watch out for. Really high productivity standards, it's a no-go. All right. The second thing that you want to look out for is the multiple interviews. Now, when you are applying for a medical coding job, it is not unusual to get a test, right? Because they need to test you on your skills and your proficiency in coding. So they are often going to send you a test if they like what they see on the resume, or maybe they did a pre-screen or something like that, and they send you a test to do. And that's not unusual. That's a standard practice in hiring for medical coders. So once you do that test and you complete that test, and some people, they get upset because the test takes so long, but again, you are somebody that they're going to be investing in, and this is a part of being a medical coder. It's just like having to maintain your credentials by reporting continuing education units. That's additional time that you have to spend in order to maintain your certification. This is their way of testing you and what you have to bring to the table. Because if you are brand new and you have a good amount of potential and you show a lot of understanding of what you're doing when it comes to the coding, maybe you might get some wrong, but if you show potential in this test, that's when they're going to take a chance on you. That's why taking those tests and taking them very seriously is very important. But when you are asked to come back for one interview, that's a good thing. 2 interviews, all right, I understand that. 3 interviews, now you're starting to play with the person's time. The employer starting to play with your time. So here's the thing. I have always said, keep your interviews down to 2. Sometimes they say, well, you're going to meet with the HR person, and then you're going to meet with the coders, the coding supervisor, and some of the other staff, and then we want you to meet with the owner. Okay, that again, it's a little shaky there, because to me, too many asking the person to come back and forth, you're playing with that person's time. 2 interviews should be the max. And I would really suggest that you think about it long and hard if you want to go through that 3rd interview, because to me, that's too many hoop jumpings. You shouldn't be putting medical coders through that. It doesn't matter if they're brand new. What matters is that how is that organization showing their organizational skills? If you're having somebody, we want them to come in for an HR interview, then we want them to come in for a coding panel, supervisor and everybody else interview, but then the VP or the president can't be in on that meeting too? Or why do they have to be involved in this meeting? That we have to have it separately in order to bring you back in for a 3rd interview. You're applying for a medical coding position. This is something, these 3, 4, 5 interviews, I could understand if you were going for an executive position in the C-suite. Then I could understand, because there's a lot at stake. Not that there's not a lot at stake when you're coding, but at the same time, you really need to look at how much time do you want to invest in this, because people will waste your time if you let them. I've learned that. And so what I have learning that is I'm very, very careful with my time. That's why you do not see me answer a lot of questions that are the same over and over again. I refuse to do it anymore. I used to be as accommodating as I possibly could. But then I thought, these people are not taking the time to look through my videos or look through all the resources or to even Google, or when I tell them to look in the description box, they ignore me and they still ask me the question. Again, it's people trying to waste your time. And don't think that they won't try to do that when you're out there applying for jobs. So if they're asking you to come back and forth, because they need to make a decision and do this and do that, again, I would really kind of go with just 2 interviews and then that's it. Because again, I've heard of people saying that they were brought back 5 times and then they said, oh no, we're going to go with a different route. If it takes you 5 times to sit there and try to pick through people, oh no, there's a problem with your leadership at that organization. Because leadership should be able to say, okay, this is what we want. Because leaders, a good, genuine, healthy leader is going to know exactly what they want. And they're going to know exactly who's going to be able to do that. Leaders will be able to spot who has the skill to do what. And that you can see. But there's going to be some people that are going to be in leadership that have no business being in leadership because their incompetence shows. And to me, if you're bringing a person back 5 times for a medical coder interview, no, you are wasting my time. So try to keep it to 2 interviews only, and then that's it. If they try to keep coming, bringing you back, no, that's a waste of time. Okay, there's other places that you can apply. And before you say, well, Blue, no, in my area, okay, it's because you haven't been listening to any of my other videos where I have said before. There's other positions that you can apply for. And of course, there's ones that you can find online. I do not recommend working at home, though, your first job out. But again, if this is for if you're looking for a job and they keep trying to bring you back and forth, no, you need to keep it to just 2, because they would be able to decide from there if you're going to be a good fit or not. Okay, they don't need to keep trying to bring you back and forth, because too many back and forths, no, now you're wasting my time. And time is precious. That is the most precious thing that you can give somebody, is your time. Because time, again, once you give it, you cannot get it back. I'm just saying. So the final thing that you have to look out for. I talked about this on Thursday last week because a person had sent in a message and said that they have a CCS, which is the gold standard of medical coding credentials. Now, before you say, well, no, I heard the CPC is the gold standard of medical coding credentials. Let me give you a little bit of education. CCS says, the Certified Coding Specialist says that you have mastered inpatient coding and outpatient coding. The CPC says that you know how to code outpatient coding, and that's it. It is a great credential. It is still a good credential. People will look for these 4, the CCS, the CCA, the Certified Coding Associate, the CCSP, or the CPC. So if you have any of these 4, that's great. But each one of these says something different. The CCS and the CCA both say that you can code for inpatient coding and outpatient coding, that you know how to use the ICD-10-CM manual, the CPT manual, and the ICD-10 PCS manual. Okay, so again, you can code anywhere. Now, the CCSP, the Certified Coding Specialist Physician-Based, and the CPC, the Certified Professional Coder, both say that you know how to use the ICD-10-CM book, the CPT book, and the HCPCS Level 2 book. These say all outpatient rules, all outpatient settings, okay, and professional fee. That is what you can do with that. Now, somebody who's coming in and presenting themselves to you, even though they have no experience and they have a CCS, this is saying that they have made an effort and they've taken their test, and this test has said that they have a proficiency and a competency in inpatient coding and outpatient coding. If you go into an interview and they tell you, well, you have a CCS, but we need you to have a CPC for this position. And if you say, oh, okay, well, I'll go ahead and do that, you are working for somebody that clearly doesn't understand the medical coding certifications. That is not where you want to be. Because again, now, not only are we playing with this person's time, this candidate's time, because yes, you are going to be playing with their time, because then they have to study for that CPC. Then now you're going to be playing with their money. And this is money that you can't get back again. Now, remember what I said. The CCS says that you know inpatient coding and outpatient coding. That CPC, if you have no experience, you have to have an A, right? There's an A designation, which stands for apprentice. And you're like that for 2 years, right? Unless you go through their program and do all this other stuff, and then you can accelerate the removal of the A and all this other stuff. But if you have this, right, now you have to be able to maintain the CPC. So the CCS, to maintain one medical coding certification, if you have one medical coding certification with a HEMA, the CCS, the CCA, or the CCSP, these all require 20 CEUs. Now, 20 CEUs, the continuing education units, that's CEU, right? That is what you have to do every your reporting cycle, which is going to be 2 years. Both associations require a 2-year reporting cycle. You have to come up with 20 continuing education units. Now, sometimes you will get these for free from your employer. Other times you can find low-cost ones. You can go to national conference or even your state component association conferences and be able to get the CEUs that you need to be able to maintain your certification. But AAPC, because it is a for-profit organization, and that's just the truth. It's not me trying to insult them, because why would I do that? I have always said to y'all that they both have equally good parts, okay? But here's the thing. AAPC is a for-profit organization, so they don't have some of the restrictions like a HEMA does. So if they want to charge you for membership every single year, they will. A HEMA does not. The American Health Information Management Association does not require you to be a member every single year when you have a CCS or any of their other certifications. But AAPC, if you have a CPC, it does require you to carry a membership every single year, and you must also report 36 continuing education units for one certification. So it is $205 every single year you have your credential. If you do not pay your certificate, your membership fee, they will revoke your credential and take it away. So all that money that you spent trying to get this certification, because this employer is insisting that you get another certification, even though your CCS already says that you can do that. Does this make sense to you? So that's the thing, $205 a year, $410 for the 2-year reporting cycle, plus the 36 continuing education units, versus not having to pay a mandatory membership fee and being able to report 20 CEUs. Yes, you do have to pay to report the CEUs, but it is certainly not $205 every single year or $410 for the reporting cycle. So if they ask you that, oh, well, we want you to have a CPC or the CRC or any of these other ones, we need you to have all these other medical coding certifications, you say no. Thank them for their time and walk away. Because again, that person's not understanding what these medical coding certifications are. And they're out there, okay? There's a lot of people that do not understand what we do as medical coders. They don't understand our purpose, and they don't understand our duties and what these credentials mean, unfortunately. So that is why you have to not blindly follow along with what these people are telling you. Because that person had said, well, you need, the VP was the one who told them that they needed to have a CPC when they already have a CCS. She was already ready to go and take her CPC. And then they called her after that and said, oh no, we're going to go with another candidate. Can you imagine if she had already signed up for the CPC course and signed up for all these other things so that she could start taking it? Then she's out all that money because this ignorant person told her that she has to have it when she already has the CCS that says that she's mastered it. So let's think long and hard when they're asking for ridiculous things like this. An employer will not ask you to do that if they know and they're competent in what they're doing. Because again, if they don't understand that little bit, what makes you think they're going to understand other things that happen when you are there and you're trying to code correctly and somebody else wants you to code incorrectly? Think about that, guys. Think about that. I'm just saying, okay? So you only need one medical coding certification to start. It is your choice to get additional credentials. And I have said, if you're brand new, that you need to wait at least 2 years before you start racking up other credentials. Because again, it doesn't make sense to be brand new to the field with less than 2 years of experience and have a whole conga line of credentials after your name because you're trying to look impressive. When I see that as a veteran coder, I know that person's trying too hard. You are taking too many tests. You're giving your money away in hopes of making big dollars. You know, I've made big dollars with just the CCA when I had it. And I did that for 13 years. So nobody can tell me, oh no, you need this, you need that. Crap. Nobody can tell me that. Because I know. And as a veteran coder, I know what it takes. And they want knowledge. They don't want all these credentials. Not unless you're getting up there in leadership and that kind of thing. Then that's something completely different. But I'm talking about medical coding. Okay. So with that said, I'm going to wrap this one up because I'm almost out of time. But good luck out there, guys. You can do it. Don't let yourself be pushed around just because you're brand new. You have talent, you have skill, you have knowledge. Use it. And don't just blindly follow. You do your research when they're asking you these additional things. Now, that's just what I'm going to say. So, with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.